Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and with us is today Dr. Laura Power. She is an obstetrician and gynecologist at Thunder Bay Regional Health Science Center in Thunder Bay, Ontario. And today we are going to talk about women's health related questions concerning overall general health of the woman as well as maternal health related questions. Thank you, Dr. Power, for coming to the show.
Thank you for having me.
Please tell us about overall about importance of women's health.
So women's health is important because women have a lot of unique changes that happen in their lives from puberty into their reproductive years and then finally going through perimenopause and menopause. So there are a lot of opportunities in a woman's life in order to improve their health.
So what are some of the most commonly challenging problems faced by the woman?
Honestly, the most common problem that I see in my office are actually menstrual disorders or problems with periods. Either they're painful or they're heavy or they're long, and there's a lot of economic impact both to society as well as to a woman's personal life that's impacted by that. Other common problems could be abnormal pap tests and problems with different types of endocrine functions, such as ovulatory dysfunction or problems getting pregnant.
So do you see a lot of problems in the young age or middle age or old age? Which age group is most commonly affected with the problems which you just described?
In my practice, I see a lot of middle-aged to older women. And then on the other side of my practice, I do a lot of obstetrics. So then I see a lot of younger women at reproductive age.
Right. So what are some of the screening methods which are recommended at this time for the woman's health well-being?
So the most common screening method that I think people would be most familiar with would be a pap test. The guidelines change all the time, and the most recent guideline suggests a pap test every 3 years.
Okay, so what one has to do for the pap test? They go to the family doctor or obstetrician or gynecologist? How does that happen?
Access to pap tests can seem intimidating and difficult, but actually there are a lot of places that a woman can access a pap test. First and foremost, if they're lucky enough to have a primary care provider like a family doctor or a nurse practitioner, they can get their pap tests from them. Obviously, when patients come to see me, if they're due for a pap test, then I'm happy to provide that, as are my other colleagues. But if a person doesn't have a family doctor or a primary health care provider, they can always access the sexual health clinic at the health unit. And then there's also the bus that the Cancer Care Ontario has, and there's breast screening there as well as access to pap tests
so
as well.
So they can do the pap test on the bus as well, right? Now, other than the pap test, what are the other screening tests recommended for the woman's health?
So I'll start with younger women. So screening tests that might be important would be screening for sexually transmitted infections throughout your life. And then as you get older, we start to worry about bone health and breast health. So mammograms start around age 50, and then bone density screening starts at various ages depending on your risk factors.
So sexually disease test screening, how does that happen? What is the test? Is it like a blood test or?
It's both. So it can be a blood test, it can be a urine test, or it can be a swab.
So that one also can be accessed through the family doctor or through the?
Yes, they can be accessed through your primary care provider, through an obstetrician gynecologist, or at the sexual health clinic at the health unit.
Now you mentioned about the mammogram. Please tell us about mammogram, how it is done and who does it.
A mammogram is a radiological test. It's essentially like an X-ray of the breasts, and they look at the density of the breast tissue in order to try to decide if there are risk factors, if there are any lumps or bumps present that need to be looked after.
So that has to be done after age of 50 every year or every second year? How frequent has to be done?
So for the most part, I believe it's actually every second year now. I could be a little out of date with my information, but it also depends on your personal risk factors. So if you have a family history of breast cancer, often it started 10 years before, say, your mom had breast cancer. So for everybody, the screening is actually different.
So if family history, then the screening is earlier. Now the third one you mentioned about is the bone health. Please tell us something about bone health in women.
Bone health is especially important for women because estrogen is actually very important to build healthy bones. Testosterone is also important, and that's what helps men have healthy bones. When women go through menopause, they get less and less estrogen over the years, and potentially their bone health can be negatively affected. Also, in our reproductive years, when we're pregnant or breastfeeding, we have different levels of estrogen as well, and that also affects our bone health. So in order to have healthy bones, we want to have a lot of calcium and vitamin D in our diet, as well as some regular weight-bearing exercise in order to keep our bones healthy so that when we're menopausal and we're older, we have healthy, strong bones.
So as the age increases, the estrogen decreases, which leads to weak bone. Is that what happens?
That's exactly what happens.
And that is what we call it as osteoporosis?
Yes, that's osteoporosis.
So what is the age when it starts?
The age of screening, I believe, is around age 50 as well, but also, again, it kind of goes back to your personal history. So if you have a family history of bone disorders, or if you have a medical problem that could create unhealthy bones, then that would be a reason for screening. So for example, if you went through menopause earlier than average, and the average age in Canada is about age 52, that would be a reason to start screening earlier.
So at the age 50 or 52, what screening methods are used to screen for osteoporosis?
So usually your primary care provider can order a bone density test, which is another radiological test that looks at how strong and healthy your bones are.
So once that bone density testing is done and if it shows there is bones are weak, so what is further done to prevent the fracture with osteoporosis?
So this is beyond my area of expertise. So usually a gynecologist can be the one that diagnoses low bone density, but then we refer on to another colleague who looks after them. And then they usually recommend a medication called bisphosphonate, but sometimes they also use estrogen hormone replacement therapy in order to help keep your bones healthy.
Do younger patients also develop osteoporosis or just older patients?
In some cases, young patients can develop osteoporosis, and actually bone health starts when we're very young, so it's important for teenage girls and women who are in their early 20s to get a lot of calcium while their bones are just being built and getting strong.
Now tell us about the puberty. When the patient is young, it says puberty age, and what does a girl undergo changes in the puberty?
So puberty is often a difficult time for everybody. And so the average age of puberty in Canada is actually decreasing. So I think when I started medical school, it was somewhere around age 12 and 13, and it's becoming lower and lower, and it's around age 10 now. And so what happens is that girls start to notice different changes in their bodies relating to the different levels of estrogen and progesterone. So they may notice some breast development, maybe pubic hair development, and then finally they start to menstruate.
Okay, so now once the puberty stage is done, then there comes the pregnancy stage. Please tell us about the importance of maternal health in the woman's health.
So maternal health actually starts well before women get pregnant. So it's important to have healthy habits like regular exercise and a healthy diet, as well as taking prenatal vitamins that contain folic acid. It's also important to have really good iron levels and calcium levels too.
So you mentioned about the diet. So what are some general guidelines for the diet?
So the Canada Food Guide is actually an excellent place to start, and having a healthy diet involves eating a wide variety of foods, including lots of fruits and vegetables, especially legumes, which are very good for our digestive health, our heart health, and our reproductive health.
We'll take a short break and we'll continue our discussions on the maternal health after the break.
Sounds good. Thank you.
Thank you. Welcome back to the show Talk with Your Doc, and today with us is Dr. Laura Power, who is obstetrician and gynecologist at Thunder Bay Regional Health Science Center, and she is guiding us about the women's health related issues. Dr. Power, you were mentioning about diet and the maternal health, and the Canada Food Guidelines was the place where we can start. What is the importance of exercise in the pregnancy?
Exercise is important throughout our whole lives, but especially in pregnancy. So in my experience, women who have regular exercise involved in their regular lifestyle often have an easier pregnancy in terms of managing all the musculoskeletal pain that can happen during pregnancy. So strong muscles help women to carry a pregnancy well.
So during the pregnancy, there are certain exercises which are recommended by obstetrician and gynecologist, or?
To be honest, no. Women can participate in a wide variety of activities. It actually depends on your previous exercise activity. So often women who are first pregnant, they might not be able to participate in activity because they might feel nauseous or exhausted. And that's completely normal. But usually after the first trimester, women are able to resume activity. And then my general advice is for them to just continue on until their bodies tell them that they can't continue that regular level of exercise.
They can continue the regular exercise even during the pregnancy.
Yes. So the important thing is not to suddenly start excessive exercise once you become pregnant. But if you're already very active, then it's okay to stay very active.
That keeps the health of baby and the child.
It's true. Exercise has been shown to affect our lives positively in so many ways, and pregnancy is one of those ways.
Right. Now, so diet and exercise, what other lifestyle factors should be modified during the pregnancy to maintain the maternal health?
To be honest, not a lot needs to be modified. So women's bodies are amazing and they just change naturally with pregnancy. And so most women are able to continue working, continue exercising. They may slow down a little bit, but as long as they started off healthy and their pregnancy stays healthy, then they're able to participate in work and lots of activities.
Do they have to stop smoking or alcohol or drugs?
Yes, so those types of lifestyle changes are important. They're especially important when someone's considering getting pregnant. But if you're already pregnant and you're smoking, quitting smoking helps to make the babies grow better. It helps the placenta develop. And there are lots of benefits that happen even if you are smoking already to quitting.
Does alcohol have effects on the baby?
Alcohol does have negative effects on the baby. We do know that excessive amounts of alcohol can cause fetal alcohol spectrum disorder. And lots of women are worried because they may have had a drink or two in the beginning of their pregnancy before they knew they were pregnant. Evidence shows that that is probably okay, but excessive drinking throughout the pregnancy has known negative effects on the pregnancy.
Smoking and alcohol are not good for the pregnancy.
Definitely not good.
So they should be stopped all over.
They should, yeah.
And there are various other drugs, recreational drugs and drug addictions. Do they have an effect on the pregnancy?
Yes, so unfortunately there are a lot of women in our community who do suffer from addictions. It's important to differentiate the use of recreational drugs or street drugs with the use of prescription medication. There are a lot of unknowns with recreational drugs and they're generally considered unsafe in pregnancy. However, under the supervision of a doctor, there are lots of women on Suboxone as a preventative measure, nicotine replacement patches, that sort of thing. Those are actually beneficial to pregnancy because they're considered harm reduction.
So one should stop all the recreational or any sort of addictive drugs during the pregnancy.
Yes, that's the goal.
Right. Now, what are the most common health-related issues or problems faced by the woman during the pregnancy?
So common health-related problems that I see during pregnancy would be high blood pressure during pregnancy, excessive weight gain in pregnancy, gestational diabetes, and also babies that grow small because of problems with the placenta.
So when does this problem start? Like in first trimester or second trimester? Or when do all these issues start? Like pregnancy-related hypertension or diabetes? Or
these typically start in the second trimester. Now, physiologically, they probably start very early in the pregnancy, but they're undetectable until usually the second trimester.
So when should a woman approach for the maternal health to a doctor?
So when women find out that they're pregnant, it doesn't matter how early or how late, they should always present to a healthcare provider who will help refer them to places that they can get maternity care.
Okay, so they can go to their family doctor or obstetrician and gynecologist. Where should they start?
Women can actually start anywhere because most healthcare practitioners know how to help them. So if you don't have a family doctor, then you can present to a walk-in clinic. I work at the maternity center and you can self-refer there. So the maternity center is a place at the Thunder Bay Regional Hospital in the Professional Sciences building, and we have a nurse practitioner there that can help sort people out and then refer them on to an obstetrician or a family doctor.
So they can go to a family doctor. If they don't have, then they go to maternity center. And do they go directly to the obstetrician or gynecologist clinic? They can go?
No, so you need a referral to see an obstetrician gynecologist, but any family doctor or any nurse practitioner can refer. Women can also self-present to the midwives. So we have 2 midwifery clinics in our city, one on the north side and one on the south side, and you don't need a referral to see a midwife.
What is midwife?
So a midwife is a medically trained professional who specializes in caring for pregnant women and their newborn babies. They typically have a 4-year schooling where they only study pregnant patients. And before that, they probably have an undergraduate degree or a master's degree.
So where are the midwives located in city?
So there is let's make sure that I get this correctly. The community midwives are on Victoria Avenue, and the maternity care midwives are on Villa. So one on each side of town.
And people can access them or search them on a website or Google or something?
They do have websites, so you can Google them, or you can just call and make an appointment to see them.
Now, sometimes patients say that I have my family taking care of me. Why do I need a family? Why do I need the care of a midwife or a doctor? So what do you say about that?
Well, I mean, family is actually very important for a pregnant woman. There's a lot of changes that are happening in her life, physiologic changes, body changes, and also household changes. So family has been shown, we know, to be extremely helpful in helping to support the women through these changes. However, a trained professional who looks after a pregnant woman, like a midwife or a nurse practitioner or an obstetrician, is trained more to recognize medical problems in pregnancy. And so it's really great when the pregnancy goes well, but we're trained to recognize problems early to try to prevent harm to the baby and to the mom.
So even though you have somebody looking after you at home, it is very important to go to a doctor.
I would agree.
Now, somebody says that I have been pregnant before and I've delivered a baby. Why should I go to a doctor now when I never went before in the previous pregnancy? Is there any need to go to the next pregnancy to a doctor's care?
So I do hear that often, and it's true. Once women have one baby, often their next pregnancy is fairly predictable. Their body seems to know what to do, and they have easier pregnancies and easier labors. That being said, every baby is different, every pregnancy is different, and so a trained professional, either a midwife or a nurse practitioner, or even an obstetrician, if they have a referral to see one, would be able to recognize complications of pregnancy early.
Right. Now, some people say I can't afford the doctor's health care. So what do you say about them?
So in Ontario, if you have a health card, OHIP covers prenatal care, either through a midwife or a nurse practitioner or an obstetrician or family doctor. Ultrasounds are also covered. In fact, most, if not all, of the tests that are required during pregnancy are covered under OHIP.
Okay. Thank you, Dr. Power. We'll take a short break and we'll continue the discussion on maternal health. Thank you. Please stay back for the last part. Welcome back to the show, Talk with Your Doc. We have Dr. Laura Power, and who is guiding us today about women's health related questions. Dr. Power, you were mentioning about maternal health, and one can get the access through the OHIP or insurance programs. Now, suppose somebody has an appointment with a doctor in the maternal health, and if they miss the appointment, what should they do?
So it's always stressful for patients when they miss an appointment, but what they need to understand is that we're here to help them, so we're always excited to see them come back. So if an appointment is missed, a simple phone call to the healthcare provider to rebook is usually all that's necessary. Sometimes for my high-risk patients, I end up calling them to rebook. So it's important for women to access healthcare during pregnancy.
Even though they miss appointment, they should make a point that they go and book another appointment.
Yeah.
And not miss the health care.
Exactly. And I mean, sometimes things happen, and so, we all can't make our appointments all the time, but the important thing is to follow up again and try to access care.
Now, during the appointment, can a woman bring the partner? How important it is to bring them?
So partners are always welcome. Not necessary, but if you have a family member, it doesn't even have to be your partner. It can be often grandma or grandpa or older siblings. They want to come and hear the fetal heartbeat, and they are always more than welcome to come.
Now, what investigations are involved in the maternal health investigations?
So there are some routine tests that we do during pregnancy. None of them are mandatory, so often we give women the choice if they want to have a test or not. And so, the typical prenatal screening when women first present when they're pregnant involves blood tests to check their hemoglobin and iron levels. Often we're checking their thyroid as well. We do tests to make sure that they're immune to certain diseases to protect the fetus. We also check to see if they're exposed to any serious infectious diseases like hepatitis or HIV, because if they are positive, then we can treat them to try to prevent transmission to the fetus.
So all these are blood tests?
These are all blood tests. Often we take this as an opportunity to do a pap test as well, and we generally screen for sexually transmitted infections at that time too.
Is there any radiological test you do to check the well-being of the baby?
Yes, so in Ontario we do a first trimester screen. So women get an ultrasound when they first find out that they're pregnant, because that's the most accurate way to determine the due date of the baby. And then later on at around 11 to 14 weeks, we do a test that is optional, but it checks to see if there's an increased risk of a genetic abnormality in the baby, such as Down syndrome.
So that is also ultrasound test?
It's an ultrasound and a blood test combined.
Okay. Now, to detect this congenital abnormalities, is there any invasive procedure or just the blood test?
We just start with the screening test, which is the blood test and the ultrasound.
So it is very important to screen the well-being of the baby along with the mother's well-being.
It's true. We have two patients as obstetricians. We have the mom and we have the fetus. There are more tests that happen. So at 20 weeks, we also check the baby's anatomy, so we make sure that they have all the parts that they should. And at that time, we sometimes check the length of the cervix, or we might check to see where the placenta is. Later in the pregnancy, we screen for gestational diabetes. And then finally, in the third trimester, we look for infections like group B strep.
So all this screening is done during the visit. So the visit is very, very important.
The visit is very important. It's often very short too. It doesn't have to be a long visit. We always check blood pressure at every visit, and then we just chat and make sure that mom is okay.
Now, if some patients are dealing with the drugs or alcohol related issues, where do they get help from?
There are lots of places for women to access care if they're suffering from addictions. So at the maternity center, we have a social worker that can help us organize that. There are a few psychiatrists in town that specialize only in pregnancy. And then there are a lot of clinics in town that help women who are using methadone and Suboxone. And we work very closely with them in order to make sure that the baby and the mom are healthy.
Now, during the pregnancy, some of the mothers get depression, anxiety. How do they deal with that?
That's a very good question. Depression and anxiety aren't really talked about a lot, but they're very important. It's more common than we think, and some of it is hormonally related. So women who feel like they are having an abnormal mood or a depressed mood should really tell their healthcare provider right away, and there are lots of services for them in order to help them out.
Sometimes women during the pregnancy undergo depression and they feel like I can't cope it anymore. What should they do then?
Definitely present to a healthcare provider. So it doesn't matter who. The most important thing is the health of the mom and the baby. So if a woman says that she is feeling very depressed, then she needs to see a healthcare provider right away, even if it's a walk-in clinic. If a woman tells somebody that she feels like harming herself or her baby or her fetus, then she needs to present to the emergency department. There are a lot of resources in the community that help parents, including what we have at the maternity center. There's also Healthy Babies, Healthy Children through the health unit, and you can refer yourself to that. Your family doctor or a nurse can refer you. And then there's lots of community resources as well that help parents out who are...
There is always a help available.
Exactly.
Now, going from the pregnancy to perimenopausal and postmenopausal age groups, they have different questions than what we were discussing now. So tell us about perimenopausal. What happens, what age starts, and what are the symptoms?
So perimenopause starts at different ages for different women. The definition of menopause is not having menses or a period for a whole year. So prior to that, it's called perimenopause. The average age of menopause in Canada is age 52. And so prior to that, often women's cycles get closer together. They can often get heavier. There might be mood-associated changes. There's a lot of changes that can happen as early as age 38 and 40 in some cases.
Okay. And what sort of problems they face?
Well, the problems that they face usually have to do with their menstrual cycle. It becomes more irregular and heavy. But other problems such as mood disorders, hot flashes, night sweats, difficulty sleeping, some women get more joint pain, itchiness. These are all symptoms of perimenopause.
And that's when the osteoporosis also sets in.
Exactly. Then we start having to think about bone health and breast health.
So how do you deal with this perimenopausal and menopausal symptoms and signs?
Well, the simplest thing, or the simplest way to start, would be lifestyle changes. So it's important for women to understand triggers for their hot flashes. Often it's caffeine and alcohol, so cutting back on that. Decreasing the use of alcohol also decreases the risk of breast cancer. Healthy amounts of exercise and a healthy diet often helps decrease hot flashes and night sweats as well. Weight loss often helps, which is not easy. It's easier said than done.
Yeah.
And then there are medical treatments that a physician can prescribe that can help women at this stage of their life as well.
Right. So taking adequate exercise, proper diet, lots of calcium probably, and visiting a family doctor is very important.
Very important. And I'd add vitamin D too.
Vitamin D too. Right. Thank you, Dr. Power, for coming today and guiding us about the women's health related questions.
Thank you so much for having me.
Thank you. Thank you so much.